Welcome to this demonstration of the Vaccine Registration and Administration Solution for Government and Health Organizations from Microsoft Consulting Services. The Vaccine Registration and Administration Solution, also known as VRAS, is a secure and flexible platform that allows government and health organizations to rapidly assess resident risk and schedule vaccinations for diseases such as COVID-19, track and report health data using HL7 standards, and streamline the enrollment of vaccination providers. VRAS supports security and privacy of applications as well as data compliance with local policies and laws such as GDPR and HIPAA. Let's take a look at the solution from the point of view of a resident, Alex Wilber. Alex can use the secure VRAS portal to answer a set of health assessment and demographic questions. Government and health organizations can easily configure these questions and determine which responses are required to place residents like Alex in different risk categories in order to assign them to different vaccination phases. Once he's finished with the health questionnaire, Alex enters his personal details for easy follow-up. Before he submits his information, Alex verifies that it's accurate. Based on his answers to the assessment questionnaire, Alex was placed in the first phase, and he can immediately schedule an appointment to be vaccinated. He selects a location and open appointment time. To prevent fraudulent bot activity, the solution prompts him to enter a code from an image before submitting his appointment request. Just like that, Alex has completed his registration and booked a vaccination appointment. He also gets an email confirmation with a QR code that he can bring to the vaccination appointment for check-in. Next, let's switch to the point of view of Diego Siciliani, a health staff member at the provider clinic that is administering vaccinations. Diego uses the VRAS Power app on his tablet device to quickly check in vaccination patients. He can simply scan the QR code from the confirmation email, which patients can print out or show on their phone, and the system brings up the patient's record. Diego confirms the patient's information and checks him in before sending him back to see the medical practitioner who will administer the vaccine. Joni Sherman is a medical practitioner at the clinic. When patients arrive at her station to have the vaccine administered, Joni too uses the VRAS Power app to scan their confirmation QR code. She also scans the GTIN, or Global Trade Item Number, of the vaccine. This automatically records vaccine batch details such as the manufacturer, serial number, and dose, which can also be entered manually. And then she manually enters the lot number and the bodily location where she will inject the vaccine. Once the vaccine has been administered, Joni and the patient both provide their signatures to verify that it's been done. In the background, VRAS sends an HL7 message to the Immunization Information System, as mandated by government to track vaccination data. After his vaccination, Alex gets an automatically generated follow-up email, personalized to match the vaccine he just received, with helpful information and a link to book a follow-up appointment for his second dose. Alex also receives an email with a link to a health survey to help government agencies track any adverse effects. After confirming his date of birth, Alex can record any complications he experiences, such as a fever or other side effects, along with the date they occur. Now, government and health administrators can see the details of each vaccination record and track any reported complications down to the vaccine batch they're associated with. By collecting data this way, VRAS allows administrators to get a comprehensive list of reported complications for each vaccine batch they administer, which can help improve public health reporting and decision-making. Dashboards help government and health organizations visualize key vaccination administration data to provide more effective analysis and better forecasting. Next, let's look at the process of provider enrollment from the point of view of Lidia Holloway, a clinic manager. Lidia uses the VRAS portal to register her clinic as a provider so that residents can schedule vaccinations there. She reviews the provider criteria and confirms her clinic's eligibility. Next, she creates an account and enters information about her organization. Lidia creates new locations where patients can book vaccinations. Then she enters details about the storage units available at those locations and the refrigeration capacity to store vaccines. On the back end, government and health administrators can review provider enrollment applications to determine whether they meet the approval criteria for administering the vaccine. Once approved, vaccination providers can use the secure VRAS portal to manage their locations, including scheduling, vaccine inventory, and appointment bookings, all in one place. You've just seen how the Vaccine Registration and Administration Solution allows government and health organizations to assess risk and schedule vaccinations, track and report health data using HL7 standards, and streamline provider enrollment. VRAS supports the security and privacy of applications as well as data compliance with local policies and laws such as GDPR and HIPAA, and will evolve as new requirements are determined. For more information, please contact your Microsoft representative.